right, people living with mental health issues and the criminal justice system. The two together are a growing problem. Some studies reveal nearly 20% of prisoners have a serious mental illness. Now, recently, I met up with two experts to talk about how people are falling through the cracks.
How is this happening? Who is dropping the ball?
It's more complicated than that. It's the perfect storm. It's deinstitutionalization of the hospitals, the war on crime, the war on drugs, not having good access to treatment. It's no one party or one person's fault, and everybody needs to come together to fix it.
So what I'm hearing here is there's no blame game here.
There's no blame game.
So then where do you even start then?
It starts in the community. 80% of the solution is in each individual community. It's having better systems of identification in the jail. It's training your police officers in something called crisis intervention team policing, so they stop arresting people unnecessarily and getting them to treatment. And then it's having a program in the court system to access the treatment system in the community.
So when a mentally ill person does get locked up, how can they get the treatment they need when they're behind bars?
All jails should be required to do assessments and evaluations to identify people who may be in need of services, and then they should be properly served at whatever level of treatment is required. The greatest failure is the lack of follow-up care in the community. They're treated in the jail, stabilized in the jail, and most people don't stay in jail for a very long duration. Then they go back to the community.
So you're saying that they get the treatment, overall, you're saying that they need while in prison or in jail, but once they get out onto the streets, that's when things break down.
Right. Yes, they break down because there's no continuity of care. There's no bridge to take them from the jail, which is, of course, part of the correctional system, to the mental health treatment facility, which is part of the mental health system.
Well, the problem is there's no warm handoff. And even a day in jail for some of these individuals with serious mental illnesses makes things worse. So the key is to identify them quickly, and for people that have not been charged with serious offenses, to divert them almost immediately.
So it can't be just from point A to point B. There needs to be something in the middle in order to stop this from happening.
The middle and the end. And it's very easily done. It's less expensive. We closed one of our main jails just by getting people treated. So it can be done, it's cost effective, it improves our public safety, it spends our tax dollars better, and it's identifying the right people and getting them the right treatment.
Most people in the system, if they haven't been properly schooled in that particular area, don't see people with mental illness as being sick. They see them as people who are acting out, and sometimes that acting out can lead to their being put in segregation, and that exacerbates their symptoms.
And the last question is, you say there's a way to help people, right, with mental illness rather than having them incarcerated. That's what we've been talking about the whole time. What are these alternatives, and are they in place right now?
Not enough in Florida. We're 51st per capita in mental health funding.
And how can that be happening? If there's not enough here, there must be other states where there's not enough there either.
Well, it's difficult, but half the battle is getting access to treatment, helping people get on their medication and stay on their medication, and using the better practices that we know that work. People with mental illnesses have better recovery rates than people with diabetes and heart disease. The key is identifying it as early as we can and getting them treated.
Now, both experts agree there is a need for more services, and those services obviously depend on the mental health issues the prisoners are living with.